They're live.
Welcome everyone to our first attempt at a hybrid health and wellbeing board, and it's lovely to start to see after about 16 months some colleagues in person. So just kicking off with the agenda on apologies. So we have apologies from Vasa, Mohan, Jane, Andrew, and possibly I think Aditi Shah as well. And just on to declarations of pecuniary interest. Are there any? I can't see any in the room. I don't think there are any on the screen. And just moving on to minutes of the previous meeting, are we happy that those are a correct record? Okay, perfect. So just moving on to the bulk of today's meeting, as we have over the past 16 months or so, we'll be reviewing and agreeing our action around COVID, but encouragingly, particularly looking towards the end of the agenda, looking forward at how we plan for recovery post-COVID and build on some of our integrated working and what our communities are telling us that they want to prioritise in the future. So just on agenda item 4, which is the Safeguarding Adults Board annual report, I'm delighted that we have Eileen Buckton, who I do want to say instinctively is relatively new to the role, but I know actually has joined us in May last year, just over the cloud of COVID. So Eileen, I'm just going to hand over to you, and perhaps if you could introduce yourself and then kick off with providing an update on the report. Thank you.
Thank you very much, Councillor. Can you hear me okay?
Perfect, thank you.
So yes, the hybrid system is working. Thank you very much for the invitation to attend this evening. I'd like to present to you the Adult Safeguarding Annual Report for 1920. As the chair has said, I'm Amy Buckton. I am the new chair of the independent chair of the Adult Safeguarding Board, and I only came into post in May, so I wasn't present during the time that this report reflects, but I was keen to come and present it to you this evening and to hear your comments, because it helps us really kind of build the report for this year, and also helps us to pick up on any concerns that the Health and Wellbeing Board might have in relation to safeguarding. I mean, I'm acutely aware that when you read this report, it feels so much like a different era, because obviously it was only the last month of that year that the COVID pandemic was making itself felt. And in so many ways that has impacted upon safeguarding issues, both for children and young people and for adults across the whole of the partnership. But nevertheless, there is a lot in the content of this report that reflects the work that was undertaken during that year. And I have welcomed some of that work that had taken place, that we've been able to build upon during this kind of COVID year in particular. I'd just like to pull out, I suppose, one or two things that I think are key in terms of the achievements for that particular year. There was a huge concern about an underreporting of adult safeguarding concerns, particularly in relation to the council. And I'm very pleased, and you will see in the report, that the number of concerns has risen considerably. Now, you might think that that's a bad thing, but actually in terms of people being aware to raise concerns, to feel that they know where to go if they're kind of worried about their neighbour or worried about somebody in their family or about a particular member of staff in the caring professions, we want to encourage as many people to come forward as possible. So I think that rise is very much to be welcomed, and it's much more now in line with the rest of London, whereas there was definitely a sort of underreporting before. I think you will see too in the report that there were a number of initiatives that took place to build the partnership itself. So absolutely kind of embedding the subgroups of the Adult Safeguarding Board, bringing partnership members together, working out sort of terms and reference, working out kind of work programs for those groups. So quite a lot of kind of process, but very important process to have a kind of stable partnership on which to move forward. And then I think you will see identified a number of learning events, some particularly on mental capacity, because that reflected some concerns at the time that had come as a result of some casework, and other kind of safeguarding events too, in terms of scams, looking at some of the kind of concerns in the community. And I would just want to point out there's a large number of safeguarding concerns that take place in people's own homes. I think people very often think it's only in a care home or in a hospital that safeguarding issues come to light, and that clearly is not the case. And you will find there the data in the report that reflects the kind of spread of different kinds of safeguarding concerns. So although I might not be able to answer questions in detail about that year, John was here during that year and was part of a lot of the kind of process development work during the kind of building of the partnership, which was a focus for that year. And as I say, we're very interested to hear your concerns moving forward and what you feel are kind of prevalent issues at this time. And also any comments about the style of the report. Is this the kind of report that you find useful? Is it too long? Is it too short? Are there things that we could improve? Those sorts of comments would also be very useful. So I'm very happy to take kind of questions and comments on any issues that anybody wants to raise, Chair.
Thank you very much, Aileen. And I suppose just at that point, reflecting on the point you made about the time of the report being developed, I don't know whether, John, you did want to come in and provide any comment at this stage?
I don't have any further comments. It's just more questions. If people have got any questions, I can provide the detail that Aileen can't do because she wasn't here.
Great, thank you, John. Could I open up to questions then, if there are any questions or, as Aileen said, any concerns moving forward, or any comments on the style of the report, for instance? No comments in the room. I can see a couple of people on the screen. Amy, I don't know whether if there is anyone else on the screen who might have any comments or questions. No. Okay, there's just one question from me, Aileen. I think within the report itself, it talks about sort of the key role for partnership moving forward. And I just wondered from your perspective, whether there are any learnings or anything that you think you would want to see to help support people, particularly post-COVID, in terms of protecting against any sort of challenges around safeguarding?
I think, Chair, that what has been very pleasing is to work with colleagues across the partnership during the COVID period. There has been very close working and in the Safeguarding Board, and you can tell that that reflects very close partnership working across Merton as a whole, I would say, and that people have pulled together in times of crisis, and have looked at how they work together, how they share resources, how they identify concerns, and that has been very impressive. And I think we are doing some work now about what have we learnt from those ways of working, and how can we ensure that we embed those in the partnership moving forward. And I think that is about having very clear plans, having clear identifiable actions that we want to take, but outcomes that we want to see, and also ensuring that the partnership as a whole is taking kind of collective responsibility for that work plan. And I feel that very much is the case now, and that that we've all kind of discussed that, and we've just recently done an audit of the year and looked at the things we want to retain moving forward. So so I feel that we are in a good place.
Great, thank you. Mark.
I'm not sure it's a question or a comment really. It's just around, obviously we're moving into integrated care systems, and there's a couple of slides later on in my and just really asking whether you see there's challenges there in terms of change and keeping the safeguarding agenda really kind of front and center, and if we'd had any thoughts about how the safeguarding partnership kind of fits into the ICS. quite a tough question. I wouldn't know the answer.
Yeah,
frankly.
I think it's a really important question, and one that I think colleagues are asking all around London, and actually within the ICSs themselves, because obviously they cover a number of boroughs. So I think strategically, it's important that we do have links at an ICS level. And I feel that we have got that, because I think that's important in terms of some of the kind of the work with health partners that we want to do at a strategic level. So, for example, things like annual health checks for people with learning disabilities is something that we can make sure that we've got a kind of strategic buy-in, making sure that we get data from our health partners, from our health providers, as well as from the CCG. Again, at a strategic level, we can have those kind of discussions and have that buy-in. But for me, safeguarding is about the local place, because that's where it's felt. That's where it's where people live, whether that's in a care home, whether it's in the community, it's where they live, it's where they work. Those are the places where people kind of experience harm or abuse. And we have to make sure that our kind of arrangements on the ground in terms of working with our health partners are strong and in place. And we have had discussions with the ICS, and they remain committed to having safeguarding presence at the local level, at the borough level, as well as at the strategic level. So I feel assured by that. But I know it's something that as we move forward, that we'll want to go on discussing. And I think our ICS partners are, just as keen to have that discussion, as I am. So I do think it is a very important issue.
And I'd just add that I think absolutely you're right in terms of the importance of it being done at place and locally, and actually for the local places to be feeding into the agenda of the ICS and setting that agenda. I think it's not necessarily, it's a two-way street really. We can affect change at an ICS level locally.
It is, and we will make sure that our data is kind of reflected at the place level, at the borough level.
Thank you. I think I can see John also has his hand up.
Yes, while it doesn't relate specifically to the ICS, for the last 2 weeks, Aileen has also been the independent chair of the Children's Safeguarding Board. And that's really exciting for me, because the two boards, it'll mean the two boards can work much closer together at a senior level, and also working on the ground around children transitioning into adults, the LEADER program, exploitation of children, moving into adults. So it's a really exciting time that Aileen will be overseeing both boards for the next year.
Thank you, John. Were there any final questions or comments to Aileen? Una?
Thank you. I just really wanted to thank the work in this annual report. I actually do think that adult safeguarding, we often do focus on children's safeguarding, quite rightly so, but adult safeguarding, I am acutely aware is really important with one of my family members who's a carer, and seeing at first hand some of these issues. And it's also good to see that partners such as the London Fire Brigade involved, who were going out into houses, unfortunately, often with other issues that they're looking at, but to pick them up. And I know that there's a lot of different work being done together with the ambulance and so on these sort of things, and picking up some of the safeguarding and adult issues in the home is as important, as was highlighted, as in care homes and other institutions. So yeah, the more we can all be and have our partner organisations aware and working together alongside, as stated, with the children as well who are transitioning, I think it's really important. So I commend you for the work that you're doing, and I hope the partners continue to offer that help and support. Thank you.
Thank you, and I think on behalf of the board, thank you very much for joining us this evening and for providing that update, and we look forward to welcoming you to another meeting soon.
Thank you very much, Chair.
Thank you. So now we move on to agenda item 5, where Dagmar is going to give us an update on the current picture of COVID in Merton, and also introducing some of the items from the community subgroup, including the vaccination equity plan and some of the work that we've done with our community partners, including Bain Voice and Merton Mancap, which we heard about at the last subgroup meeting. And then we'll also be asked to agree the local outbreak management plan to ensure that as a system, we can rapidly respond to any future threats from COVID. So I'll just hand over to Dagmar.
Thank you, and good evening. Luckily, it looks that the technology is all working. I'm absolutely delighted. So as Rebecca said, 2 parts really in the way I want to cut it, giving you a brief overview of our COVID situation, and then a few reflections so that you're updated on the work of the subgroup. If you move me on. So in summary, unfortunately, this time round, the news isn't so good. Infection rates are going up. They're going up in the country, in London, in Southwest London, and in Merton. And in London in particular, the south of the river is now particularly affected. That includes Merton. The rate you will see in this summary is 82 per 100,000 in a week. Actually, the latest is we are over 100. So these are substantial numbers and of obvious concern. You will see as well that the majority of our cases are now not Kent, which we assume means they are the Delta variant. This is the variant that is more transmissible. Now, there is a little bit of good news as well. So obviously infection on its own is only one marker. We look what is the impact. So what is the impact on serious disease, on hospitalization? And you see at the bottom of this slide, so far, our high infection rates have not tipped over into hospital admissions in any significant way. But it is fair to say that the NHS at the moment is very busy. We've got obviously Mark in the audience. It is not with COVID, but with lots of other things, including backlog from COVID. So the last thing the NHS now would want to cope with is increased hospitalization. So we're watching the picture very closely. If you move us on, I give you a little bit more of the fine granular information around Merton. These slides show how Merton compares with London, the famous tiles. I have to confess these are already out of date, so I wouldn't dwell too much on them. If you move us straight on, I show you a little bit what I mean. So on the left-hand side, you see infection rates in Southwest London. The Merton line is the black one. The light grey one is Kingston. You probably have heard in the press. Kingston had an early steep rise, but is coming down now. So we have overtaken Kingston. The blue, very steep one are our colleagues in Wandsworth. And one of the learnings is that the picture can change very quickly. On the right-hand side is the slight better news around particularly the serious end of hospitalization, so high dependency and ITU, which hasn't seen any significant increases. If you move us on. So this is important for Merton. We always look what is happening in the east and the west of the borough, and you will see on the slide on the left-hand upper bit, red is east and blue is west, and for quite a while the two were pretty close. When infections started to rise, it was the east again, and we were really concerned. It is probably due to less ability to work from home, housing situations, exposed jobs. But what you can see now is that basically the lines are crossed again, and now in our latest rise, it is more in the west. And if you look on the right-hand side, you can see it is young people. And in a way, that is also a bit of a consolation, because we know that the disease isn't as severe in young people. We also know that at least part of that cohort, 16 to 29, is still unvaccinated by default, or not fully vaccinated, and that chimes with what we know about the vaccination. And so I can use this to have the push. As you are aware, that we call it the sprint in vaccination. So over the next month, we're working very closely with our NHS partners who lead this big push to get vaccination rates up, to get this spike in infections under control. If you move us on. This is about a little bit about testing. I won't dwell on it, but just to give you a reassurance, we are monitoring very closely. We're still very much promoting the use of the LFT test. That is, just as a reminder, this is the lateral flow test that you can do at home, and is recommended when you're asymptomatic, because transmission still happens when you have no symptoms. Now, there is a little bit of an incongruence in that infection rates are going up and community testing with LFTs is going down. So I think all of us can do something to promote the ongoing use of LFTs. And so, for example, in the Civic Centre, I am assured that all of you, before entering the chamber, have done your LFT test. It is sometimes hard going, but I think we have to push and stick it out. We haven't got that many tools in our toolbox. The prompt testing is one, and as I said, the vaccination. If you move us on. Let's move on. This is more around the testing, but we don't need to dwell. So this is, again, more reassuring news. Obviously, the worst of the outcomes are deaths. You can clearly see in the pattern the two waves that hit Merton like it hit elsewhere. At the moment, we haven't had a COVID death for a while, and our overall deaths are actually below in what you see as the yellow line, which is the similar week in 2019. So at the moment, from the severe end, we look okay. But obviously, deaths are lagging behind. Last few slides, really important. As I already pushed, vaccination is now the game in town. And one of the big issues around vaccination is to leave nobody behind. At the beginning of the vaccination, remember it started in January, there were really a big gap between overall uptake in the eligible cohorts and uptake by ethnic minority groups. And I'm really glad to say it's not yet perfect, but if you look at the left-hand side, the differential between the blue and the blue and the red columns is really shrinking. And at the lower end on the left-hand side, you see how we compare with other boroughs in Southwest London with regards to that gap of not leaving anybody behind between overall and ethnic minorities. And our gap is one of the smallest in Southwest London. And that is part, hopefully due to the efforts of the subgroup, which has been very, very active working with NHS and the voluntary sector and our super community champions to really try to reduce any barriers to vaccination. And on the right-hand side, you can see how what the trend is in terms of uptake. And again, most of the gain in uptake is actually in ethnic minority groups. So that for me is this sort of silver lining on the background of increasing infection rates and some outbreaks, particularly for Councillor Stringer. She will know that youngsters being affected means schools are affected, so they have a pretty rough ride at the moment, which with some quite big outbreaks in schools. if you give me the last slide. So again, one more on vaccination. You can get the hint. This is what I'm spending lots of time. On the left-hand side, you see by eligible cohort, how many people are still unvaccinated. That is, in a way, the challenge for the sprint months. And you can see the numbers are still big. Obviously, the younger the cohort, the bigger the numbers. So we have got real plans across Southwest London, working with our NHS to actually vaccinate all these people. And I think all of us can help. And I'm delighted in the Civic Centre, we had a pop-up on Monday. We're going to have another pop-up next Monday, and the people were queuing, and we got good numbers and really smooth operating. So well done to everybody, and keep it up. That's a quick canter through the situational awareness report. And Chair, if you allow me, it might be a good idea to break briefly to see whether there are any questions before I go and report from the subgroup.
Yes, absolutely. Thank you, Dagmar. Are there any questions? I might take the room first. Una and then Ellie.
Thank you, Dagmar. And obviously we're concerned with the rate of infections, but it is good that hospitalizations and deaths seem to be going the right way. And clearly the vaccinations are the key to that. The pop-ups have been brilliant, and I think many of us have been supporting that work. And it would be really helpful, though, I think, as councillors and perhaps to some of the wider, to know when they're coming up. You mentioned this one coming up next week, and I appreciate, obviously, because of the very nature pop-up, but the more notice people, because I know the wider residents, on next door and so on, they're all saying, well, if only we'd known that was going to be, this weekend, we could have sort of done a little bit more planning to be here or whatever. So that was my first. And secondly, also a question that I've had and as yet hasn't really been answered was about Moderna. So some people have had the first dose of Moderna, and obviously some of these pop-ups are second ones. Mm-hmm. So it was whether there are any plans for Moderna at all in the pipeline. So thank you. Otherwise, I think it's, it is good work, obviously, that we're doing. So thank you.
Okay, very briefly, I think it's a really fair point around the pop-up and how can we communicate and which channels are we use so that we get maximum use. Now, the one really reassuring fact is that no dose of any vaccine gets wasted. Our operations teams, so these are NHS colleagues and a lot of volunteers, are very skilled now in matching the supply and the demand. And if there is any leftover doses towards the end of pop-up sessions, they have their means now to galvanize the uptake. So none of the doses are wasted. But I completely agree. I think I will go back to discuss with comms, and the comms from the council and the comms in the NHS are working hand in glove. And Mark might want to just chip in from his end if there's anything else. On the Moderna, we had already a little bit of an email conversation. I am, to be honest, not completely cited. I know that absolutely, if you think about the vaccination, three-pronged approach, I say now, push, the more the merrier. It's open now for the over 18s, so every person vaccinated is protecting somebody who is not vaccinated, so the more we can vaccinate, the better. Second important is get the second doses in, and because we know that the Delta variant is much better protection with 2 vaccines rather than 1. And then the third one, which is quite a different approach, is leave nobody behind. And that is a very bespoke approach to tune into individual communities, individual people, to see what are their barriers and help them to overcome. So with the second dose of the Moderna, I haven't got all the facts up my sleeve. I only know the licensing. my assumption it's 8 weeks for the over 40s, but supply-wise, I have to refer to my NHS colleagues for that.
Thanks, Dagmar. Mark, do you want to come in?
Shall I come in? So I think absolutely, in terms of the pop-up clinics, getting the information as soon as, what we've tended to do, I have to say, is probably the pop-up clinics have been organised at pace and then they happen 2 days later. But actually, it's a very fair point. We can feed that into our planning groups and try to use as many channels as we can to publicise them. I think in terms of the Moderna question, it's a really interesting one, and I think what we tend to get is here is your supply for the following week, and actually it's predominantly Pfizer and AZ at the moment. I know that in my conversations, Moderna has been talked about towards July and beyond, but certainly I was going to bring Karen in because Karen's on the front line, and just wonder, Karen, if you've got any information on Moderna specifically.
Not really, Mark, because actually Moderna hasn't been provided at all to any of the local vaccine sites. It wasn't something that has been provided to GPs. I believe it only went to the mass sites a while ago. So I would assume that the commitment for provision of second dose at the appropriate interval would mean that the second dose supply will obviously appear at the correct time. But we haven't had any, and we're not expecting to have any Moderna within our GP sites or consequently our pop-up sites. I've actually come across very few patients who've had Moderna.
Thank you. Ellie and then Simon.
Thank you, Chair, and thank you, Dagmar. Particularly glad to see that the vaccination rates of different ethnic groups here, the gap between those different ethnic groups is so small. That's brilliant. I've got 2 quick questions. Firstly, just a factual one. So I have been taking the lateral flow tests. I haven't been very good at registering the results, and seeing the statistics here reminded me, is that what we should be pushing people to do as well? Are you going to tell me off for not registering mine? And then secondly, you mentioned that obviously the growth in young people testing positive and the issues with schools. And firstly, thank you so much to you and your team for the support that you've given to schools where there have been outbreaks. But looking from my experience of seeing things going on in schools, you think that that's where the problem is. But looking at the age graph that you showed previously, it was the 16 to 29 was where there was a really high spike. So what can we interpret from that about whether schools are a source of COVID or not? Thank you.
Thanks, Ellie. So I wouldn't dare telling you off, Ellie, you know that. And I'm delighted that you're doing the lateral flow tests. I think you've raised a really fair point, that with the push to home testing, there has been in a way an acceptance almost that we are underestimating in the use of LFTs, because this last step to actually report is just another little hassle. It's not a big one, actually. So what we try to do is we absolutely try to motivate people to finish and report, because we will have a better picture. But if you ask me, if it is either I do LFTs, not at all, or I register them, I would say do them, and then use your, in a way, appeal to the civic duty that if it is positive, that you take the action. And I think that is the reality now. We're working also closely with the schools, because they're a bit in a difficult situation, that the reporting happens at a national level. We don't get school data from the national system, so we then ask the schools to report back, and we've agreed in a way that they report back the positive. So I think we will live with a slightly imperfect system, but try to at least promote ongoing use and appropriate action if the test is positive. On the second observation, you're absolutely right. In the graph that I showed you, it was 16 to 29. I've got sort of various graphs that cut the age groups slightly differently. The green line is the one slightly younger, 0 to 15, and more recently those have also picked up. So as I said, there is a little bit of yo-yoing around. Some of the hypothesis is that the transmission rates in schools definitely correlate with vaccination rates. And yes, the spillover into the younger cohorts is also still very congruent with that. Obviously, the younger cohorts have only had one vaccination or have very recently completed their 2 vaccination. And we do know that there is a lag period before you've got full immunity. So at the moment, the picture still holds as a prime hypothesis that at the moment transmission is mainly in the unvaccinated, rather than us having lots of evidence that it is tipping over into the vaccinated cohorts. And obviously, we heard Eileen talking about care homes earlier. We will all remember in our anguish in the first and second wave, and that the over 60s rates are holding up so well in terms of not increasing is a real relief in a way in terms of impact. Is that enough?
Thank you, Dagmar. Simon, and then Mark, and then Karen.
Thank you, Chair. Thanks, Dagmar, as ever, for the information. I hope I'm right, but there's talk now of booster vaccinations. Is that something, appreciate the focus that you rightly put on second vaccinations and getting to those who have yet to be vaccinated, but is that something that we've got clarity on in terms of how that will sort of overlay with the current programme and the sort of time periods involved?
So at the moment, Simon, it's fair to mention, and there has been a lot of reports in the press as well, that if really there will be an autumn booster, we would need to plan now. My very simple thinking at the moment is I haven't got any more bandwidth and I want to do the sprint really, really well. There isn't anything concretely planned yet, but a lot of activity in the background, because it is very likely that there will be an autumn booster, and potentially also, that's important again for Ellie and our schools, potentially a vaccination for the 16 to 17-year-olds after the summer break. My preference would be to have it on our radar at the moment, but our full concentration to put on getting the sprint ready, if that makes sense.
Thanks, Dagmar. Perfect. Thank you.
Mark?
So mine wasn't around vaccinations. It was just picking up on Dagmar's comments about the NHS being really busy. So I think, having spoken to St George's today, what we are seeing is we are seeing quite a lot of paediatric cases that presented at A&E and also mental health presentations. Now, some of that is actually primary care that could be seen in primary care, but primary care is so busy that people are going to A&E. So we've got some bottlenecks throughout the system, and as a system we're coming up with some plans to kind of relieve some of that tension and open up some additional primary care. What we are also seeing, and this is a generalization but I don't mean it to be in every case, is we are seeing the worried well as well. We are seeing people who are very anxious about their health. It's been a long time since they've seen a professional clinician, and so therefore are kind of pitching up at both primary care and A&E. So it's just to kind of contextualize the busyness of the NHS, really.
Thank you, Mark. And Karen?
Thank you. Mine picks up a bit probably on what Mark's just mentioned, but also I'd like to ask Dagmar, when you were mentioning about outbreaks in schools, I was just interested to know, were those cases being picked up as asymptomatic cases through the lateral flow test, or were they symptomatic children who'd had PCRs? Because I mean, you know, because I wrote to you recently about it, in primary care, we're finding quite a lot of parents who have done lateral flow tests, which are negative, but have got symptomatic children, and then taking it that their children definitely don't have COVID, which obviously is not necessarily the case. I was also wondering whether there were any risks around that if those same cohorts were potentially also attending A&E and may have COVID. I just wondered if you had any data on that, really, out of interest.
Yeah. It's a really good point, as always, Karen. Not wanting to drag you back. So if you want to have a look in one of the slides around the testing, what we always look is how many total positives have we found in Merton, and then what is the percentage that we found through LFT, and what's the percentage we found through PCR. And as the infection rate is going up, the percentage we are detecting through PCR is a lot higher. So 70, 80% through PCR and 20% through LFT. Once the infection rate drops again, so in the lull we had, it was much more 50-50, or even sometimes the LFTs leading on the PCRs when you have very small infection rates. So that just is answer to one part of your question. The other issue that you raised around symptoms has been discussed in the press and is again a very hot topic. So there are descriptions that the Delta variant it might present additional symptoms rather than only the classical ones. And as you can imagine, the type of discussions behind the scenes, what would it take to add more symptoms into the catalogue, take some out, put some in. You need to fine balance your information strategy there, because if you're not careful, you can cause more confusion. At the moment, as we've discussed for primary care as well, what we very much push is, if in doubt, test, and particularly if in doubt, you test with the PCR test. And that is what we've also discussed with our comms people, but it's very well spotted and picked up.
Thank you, Dagmar. Were there any final questions on this part of the presentation? No? Okay. Dagmar, I know you're going to move on to the overall engagement and the subgroup work. Yeah.
So I don't want to eat into other very valuable time. So allow me to canter through a little bit. Just as a reminder, this bit of a few more slides is so that the main board is really cited what the subgroup was up to. Obviously, a lot of you, a number of you at least, are in the subgroup, so bear with me, but the governance is that the subgroup reports to the overall board, so we felt it is only right that you are cited. And then, as Rebecca mentioned, there's a duty for us to produce a local outbreak management plan, to the ungracious abbreviation of LOMP, and the subgroup has pored over it and is recommending to the full board to give it its final sign-off. If you move me on. So that's what I've just said. The subgroup was set up particularly to look at inequalities, the disproportionate impact of COVID on some of our populations. It then said, let's particularly focus on the vaccine uptake. And so we've produced a vaccine equity plan. This is a collaborative plan together with the NHS and the voluntary sector and our community champions. And then we've also done this sort of due diligence on the LOMP, if you move us on. So that's a very brief overview of our vaccination equity framework. We've already spent quite a bit in this meeting, so I just want to refer and recommend it. We've tried to make it as simple as possible. We don't want to talk necessarily around hesitancy. We feel that is quite potentially stigmatizing. We absolutely recognize that there are barriers to access really operational barriers to access, and the pop-up movement has demonstrated how much we can achieve. Really, really important, the role of communication and engagement, and we mean engagement. That means tuning in and listening, and the amount of engagement events, webinars, people out and about, be it counsellors, be it GPs, be it professionals, champions, has been really impressive. Partnership and governance, that's what we are about. And finally, making best use of data. You will remember at the beginning of the vaccination, it was really tricky. And the counsellors in particular have given the NHS sometimes a hard time, rightly so, on behalf of our populations. I think we've got good data now for very granular and very focused and targeted approach. So that just gives you an overview of how we're pursuing vaccination equity. If you move us on. So this is an overview slide of all engagement and communication. So as I already mentioned, the champion are an absolutely fabulous asset that we have. I absolutely also must mention the community hub, which is giving ongoing support to our community. For example, supporting any queries around self-isolation, etc. We had good engagement with faith groups. So when we were looking for places, for example, to vaccinate, we had absolutely open doors, whether it be mosques, churches, or other sites, a Hindu temple, I think, as well. Workforce, really important. Volunteers I will mention first, but also engaging a wide range of other folks. And in the interest of time, I leave you some of the rest as sort of reference reading, if you move us on. So very important community insight work we have commissioned in our BAME Voice voluntary sector group, then Age UK for our older people who obviously took a brunt of the pandemic. And we've commissioned Men Cup so that we can hear to the voices of people with learning disabilities. And we've got a lively young people engagement so that we can really listen to what it's like for them. And out of this insight work, we are committed that it's not just interesting, but that those insights really will feed into the medium and longer term planning of the council, of the partnership with the NHS, and some of the examples are on the right hand side. There's a big consultation happening at the moment. Chris will talk a little bit in his session, so I won't dwell on it. If you move us on. And then finally, the LOMP, local outbreak management plan. So it is a duty of all local authorities to have done that. We had really good collaboration, and you see on the right hand side we've tried to strip it down because you could write big tomes about it. We wanted something snappy. What do we need to concentrate on? Temporalities, inequalities and equity right at the top. Vaccination is also there, and then the usual culprits around testing, contact tracing, etc. So I don't think there's anything controversial in the plan. It is there to coordinate so that longer term the council as well as its partners will remain COVID resilient throughout the summer, throughout the autumn. So I recommend to you that the subgroup has pored over it and recommend that the board will approve it. I think that's me done, slightly over, apologies.
Thank you, Dagmar. And were there any questions on any of those items? I think we covered the vaccination equity plan, community engagement, and also the local outbreak management plan. Does anyone have any comments or questions or any of those? I can't see any. Can I also just ask whether we can agree the local outbreak management plan as well? I'm seeing nods and general consensus, I think, online as well. Great. Perfect. So that then moves us on to the next agenda item, which is the NHS update. And I think that's an update from colleagues, which includes how we're moving forward around integration. So building on the partnership work to date that we've heard from Dagmar, and specifically across sort of COVID, but looking at how we formalise as an ICS, and also develop around the East Merton model of health and wellbeing. And I think the final item around agreeing the BCF plan as well. So I'll hand over to Mark.
And apologies, there's about 38 slides. I won't go through them at length. So I'm not going to, in terms of the vaccination, I think probably what we said is quite a lot about vaccination already at the meeting. So what I just wanted to say was Dagmar is absolutely right. There's a real sprint on until the 19th of July to get as many people double vaccinated as possible. And one of the successes, I think, in Merton has been the ability to outreach and pop up. And Karen and colleagues, congratulations on the amount of pop up and outreach that has been done. And we will continue to do that over the next 4 weeks. NHS, Central NHS are keen that we really get into communities and do door knocking and drops, etc. And I know there's different kind of consensus as to how effective that is. So for Merton, what we want to do is make sure that we're working with our public health colleagues, with our local authority, to really make sure that we get as much impact from our activity as possible. Next slide, please. The other thing to just mention is that we've had over 55 community conversations with different organisations. Community engagement is still really key, because even though we've got the pop-up clinics, we need to be addressing people's barriers to access and make sure we're having the right conversations. We're doing that through engagement, through media campaigns. We're now going to try and attract the younger populations, do things like Eventbrite booking so that people can actually book in a very different way than usual. And also that we've done a young adults webinar through our young champions, which has gone really successfully at talking to them about vaccinations and how we can do that. Next slide, please. The East Merton model of health and wellbeing. And I know this is a conversation that's probably been going on for years. And it's just to say that in terms of what the objectives were, it's about having accessible fit for purpose buildings that are safe, that can be developed and deliver different services to different communities. They absolutely need to be connected to the health and care plan. They need to be modern, they need to be sustainable, and also flexible and future-proof. And that's one of the aims of the work that has been going on around the East Merton model. Next slide, please. Again, significant health and wellbeing issues in the east of East Merton. And I think COVID has shown that more. And so therefore, we do need to make sure that we are building something that addresses the needs of that population. And next slide. And what everyone's really keen to hear me talk about is the Wilson. And actually, it's just to say that the Wilson remains the NHS preferred site. We are working with property services at the moment to identify the capital that they can invest in that. Alongside that, we're actually also looking at CCG access to capital funding through other NHS sources. And we are about to conclude some of those conversations, and we want to present the conclusion to our Merton Health and Care Together board on the 6th of July. And we are hoping that that's a very positive conversation that can really kickstart some of the community development. So I can't confirm it at this meeting, but we are moving towards the conclusion of those conversations. And next slide, please. That just basically tells you what I said, and then we will be feeding back to the Health and Wellbeing Board after that presentation to Merton Health and Care Together. Then moving on to the Better Care Fund. So the Better Care Fund is the mechanism for us to pull budgets and has a wellbeing focused across health and social care. It's a joint commissioning mechanism, and across the board there's about £20 million worth of funding that can be directed to different places. It is a national policy framework. It does allow us to bring together ring-fence budgets from local government and across the CCG, and it includes some specific funding for some specific initiatives. Next slide. That's the 20 million and the breakdown of it. I won't go into that at length, and I won't go into most of the slides. I'll take them as kind of read. And just to say that it's really important that the BCF feeds into our strategies. It's a jointly agreed plan. The Merton Health and Wellbeing Board provides the forum to agree the plan and the allocation of the funding. And it's about social care maintenance, out of hospital services, managing transfers of care. Next slide. Section 75, again, that's the agreement between NHS bodies and local authorities to make this happen. And just to say that in terms of the agreement, it will cover areas of duration, risk share, dispute and governance. The really key thing, I think, is the key priorities of integration. And in the BCF plan, they mirror the Merton Health and Care Together programme. So it's about being proactive and supporting people in their own homes through MDTs and integrated locality teams, improving the flow from hospital. And we've seen that again, the importance of that in COVID. Hospital's not a good place for people to be in long term. How do we get them out and back home as quickly as possible? We've got a rapid response service, and that's to maintain people in their own homes and make sure that we're avoiding hospital admission, and then enhance support to care homes. Working to reduce inequalities, and then the disabled facilities grant as well. Next slide. So then if we just jump forward a few slides, because then I've given you detail in the presentation about each and every one of those priorities. And what I wanted to particularly touch on really was we have added some in for COVID, particularly around enhanced discharge to assess and avoiding unnecessary readmissions. But for the Health and Wellbeing Board, just to acknowledge that one of the new things within the BCF funding is the New Age UK Living Well project, which is supporting people at home. And so again, making sure that they are maintained and not going into those kind of more traditional health and social care services, and it's kind of maximizing people's independence. Next slide, please. So BCF onwards, it's a consensus of the importance of working across the board. Focuses on personalization and bettering outcomes for people. We're building this into the long-term plan, and it's very much, we see that it is a mechanism for us to build on our partnership working going forward, and particularly in light of the ICS and the developments there. I want to assure people that actually it has increased with growth, so there is no cuts going through the BCF for this year. And that's basically the BCF in a whirlwind tour. So what I'm asking from the Health and Wellbeing Board is just basically an endorsement around those priorities, and then we will feed back on that as we go through the next year on progress made, and that progress will predominantly go through the Merton Health and Care Together partnership as well, but through our different organisations. So I'll pause there just because that was the question to the Health and Wellbeing Board.
So just on the point around the BCF, then, are there any questions or comments on that plan that we're being asked to agree tonight? No, I can't see any on the screen either, so I will take that as agreed. I suppose just as we are pausing, were there any other questions to mark around the initial part of that presentation? We also talked about sort of the East Merton model of care, so if there were any questions on that. No? Great. Well, I'll hand back to you, Mark, if there was anything else that you wanted to pick up on.
Move on to a brief presentation around the integrated care system. And when we talk about the integrated care system, it's just to note that we are doing these things at great pace. So there was a discussion document at around Christmas, and we are fully anticipating that it does go through Parliament and it is endorsed by Parliament, but the focus is to be an integrated care system by the 1st of April 2022, but to be running in shadow form around October. Now, because of the pressures that we are seeing in both the vaccination programme and in kind of pressures to the NHS system, we do fully anticipate that actually not everything's going to be done and dusted by the 1st of April. We're on a journey. Just under the white paper, ICSs will become the new statutory NHS organisation. They'll incorporate the majority of the functions of CCGs. They'll have 2 boards, one an NHS board, which will kind of deal with all NHS issues, and then a health and care partnership board. And particularly in that partnership board will be representation from health and wellbeing boards. So it's just picking up that health and wellbeing boards will be represented at the ICS South West London level. There's a time scale there in terms of parliamentary debate, which I think we've already missed, but we are anticipating that it does go through the process relatively quickly, and a new framework has just been issued last week. Next slide, please. The purpose: improve population health and healthcare, tackle inequalities, enhance productivity and value for money, and help the NHS really become a partner in terms of social and economic development at a local base. And I know that when we talk about the ICS, people talk about South West London. Actually, we're all part of the ICS, and the next slide, hopefully, is the ICS is made up of 3 component parts. One's the South West London level, and that will focus on things like strategic commissioning and doing things at scale. But really importantly, it's the ICS places that will drive local population health outcomes and the plans to address inequalities. And that's where Merton, I think, already has the building blocks to do that. So the other section of the pie is the provider collaborative. So we will see the CCG cease on the 31st of March. So clinical commissioning and such ceases, and it will be replaced by a much more provider-led set of organisations who look to allocate funding across partnerships rather than necessarily a commissioning body. Next slide, please. What does it mean for us in Merton? So place is a really important part of the ICS, and it's a two-way conversation. It's not about the ICS doing to local, it's about local influencing what we do at a South West London level. In Merton particularly, I think we've got the Merton Health and Care Together partnership. That will be the vehicle that we use. We won't be setting up anything new. That will be, we already have a great platform where we work in partnership across not only health and social care, but also our voluntary sector as well. We will be looking really to look at staying well services, preventative services, simple joined up care and treatment. We'll be developing digital services, but also to note that digital services don't meet everybody's needs. So it's just one development. Not everyone will access services digitally, and not everyone wants to. So we have to make sure it's not one size fits all. And the real focus has to be on the vulnerable and those at high risk. Next slide, please. We have nominated a place leader at Merton, and that is Vanessa Ford, who's the South West London and St George's Chief Executive. And she is the place leader managing a transition team. And that transition team includes John Morgan from the local authority. It was Hannah. Also, we've expanded the transition team in Merton to include Dagmar from public health and include Simon from the voluntary sector, because we think it's really important that as we set off on this journey, the right people are around the table. They will focus on developing primary care networks, a delivery model going forward in terms of delivering integrated care. They will review with our partners the health and care plan in light of COVID and in light of some of the inequalities that we've seen COVID perpetuate. And that's really going to be the focus, I think, for the next few months, is to get that review of the health and care plan. Now, the health and care plan was consulted on. There was lots of conversations. There was lots of engagement about it. So we are not seeing this as a whole new raft of things. We've read the discussion document. It's pretty much in the right place. But what we just need to do is make sure that we're looking at it from an inequalities lens and also a COVID lens as well. And so issues such as long COVID may come into that as well. Next slide, please. I think I've already mentioned that. So we will be looking at the health and care plan and refreshing that and making sure that we do engage where we have to engage. Next slide, please. At the moment, we're in the getting specific. So now that we've got the framework, we can start to work through what that looks like locally in terms of governance, in terms of the relationship with the Health and Wellbeing Board, and in terms of how the partnership can really start to motor on the priorities. Not that they haven't been doing that already. Next slide. That's the transition team. I'll let you look at them, a motley crew indeed. Yeah, it's just to say that we hope that that's an inclusive NHS transition team, because we wanted our local authority and our public health and our voluntary sector colleagues around the table. I think I'm coming to the final slide. We'll be developing a plan over the next 6, 12 and 18 months. Reviewing the health and care plans, be really clear what we expect the outcomes to be, and really make sure that we are engaging. And the Strengthening Communities Programme Group is local authorities, it is voluntary sector, it's making sure that we're having the right conversation with our partners. And in addition, making sure that we're listening to the patient voice and working with our community organisations so that they are driving change with us. I'm going to pause there because I'm really aware of the time.
Thank you, Mark. And I think that was a really helpful overview of what is a really complex program. But I think our experience of COVID has just sort of strengthened the value and importance of partnership and integrated working, which is reflected in there. So I'll just see if there are any questions or comments on, I suppose, the ICS working amongst members. Ellie?
Thank you very much, Mark. Specifically, at that last point, you talked about the importance of patient voice and that coming through. I wanted to check if that included youth voice and to offer help from our brilliant young inspectors that we've got in Merton if you do need support with that.
So the answer is yes, absolutely. I think what we need to work through in the next few months is actually how do we tap into those voices and make sure that, again, it's not that done to, it's working alongside us and developing plans with us. I think we've got, again, a great platform in Merton because, you know, I see sort of young people's champions and the young people's voice is much stronger in this borough than in many other boroughs. And we want to maintain that. That's, you know, we want to tap into that resource. It's a great thing to have. So I would expect the Health and Wellbeing Board to kind of keep me honest as we go through this and make sure that I am doing, you know, that engagement and making sure that we're taking our patient voice is actually, you know, determining where we go rather than the other way around. So, yeah, it'd be good to just also tap into people on how we do it. So any ideas about how we do that, most welcome.
Just one question from me. I appreciate we had the sort of transition team there. Just a question about when we're sort of defining priorities for Merton, how I suppose we can feed into that in terms of what our priorities might be as well.
So yes, I think we would use the Merton Health and Care board as our kind of conduit for the work, and we'll be taking our work through there, but we'll be doing it with the board rather than you know, behind closed doors. And I think the plan is to, particularly around start well, age well, and live well, is to set up task and finish groups and actually invite people across all the domains to actually work on particular areas of just refreshing the priorities, not necessarily coming up with new ones, but actually really looking at the actions that we're doing. I think from that, we refer back to the Health and Wellbeing Board about what the priorities are from the Merton Health and Care Partnership. We can have much engagement outside of the formal boards, and I think that's the quality of the conversation that really matters. And then a regular update to the Health and Wellbeing Board as well about how we're progressing.
Thank you. Una, did you have a question as well?
Well, it's just more to highlight that, yeah, I think the more we can ensure good communications and through this period in the transition and so on, and to allow people's voice, it's one thing to say patient voice, but to ensure that we really are reaching the right audiences is really important in this period, I think. And so really endorse that work that you're doing to make sure that we are reaching out to as wide.
So just to assure you that we did our stakeholder plan today. You're all on it. Yeah, we're also going to do some formal communications on the back of COVID. Some of the updates that we've been sending out have been quite successful and quite succinct, and people have really responded to that. So we'll be kind of using that model and then coming out to have a kind of a richer conversation with lots of different stakeholders. That's underway, pretty much kicking off now.
Thank you. Karen.
Thank you. Mark, you might have just partly answered my question. I just wanted to ask about plans for engagement with health and social care staff as well. Because I remember previously when the plan was developed, the local care plan, actually a lot of staff inputted into that plan. And obviously a lot of the changes are quite complex. And I was just wondering how we engage our staff, keep them on board and help them to be a part of developing the new models of care.
It's a really good question, Karen. I think there is something around, particularly I'll talk from a CCG perspective. So, CCGs won't exist as of the 31st of March. So we have a big cohort of staff that actually we need to manage through another change in the NHS system. So we are working with staff in CCG land. I know that John has organised for me to come out and talk to social care staff about ICS and about priorities. So we've started again that kind of stakeholder engagement, including staff, but it is a good question. It's one that I will pose to the transition team as well, just to make sure staff are fully involved. And that includes primary care staff, Karen.
Thank you, Mark. Were there any final questions? Rob?
Yeah, thanks for that, Mark. It's really helpful to see all that brought together, and I absolutely applaud your efforts to make sure that as many different voices are a part of that conversation as possible. So thank you for that, and particularly in relation to the VCS. And I'd absolutely encourage further thought into how that commissioning funding model makes sure that the voluntary sector partners that we have are able to continue to thrive, because I think making sure that to provide all of those preventative services that aren't necessarily brilliantly measured all the time, I think is a really essential part of this system as we move forward. So I just encourage a lot of detailed thought into how those perhaps smaller partners are able to continue to provide those services. But thank you for all the work that you've done to engage the VCS so far.
So I totally agree with you. I think we've got a joined up piece of work to do with the voluntary sector, and it's not just kind of the CCG and local authority. I think it extends to the whole transition team, providers, our community services, our acute services. And I think that's one of the quite exciting things, is that actually a true partnership, we could be doing things together, avoiding duplication, but also, combining some of our resources, whether that be financial or other resources, and actually really getting behind the voluntary sector. Because what we've seen in COVID was what a fantastic job they can do with cohorts of patients that that supports patients living independently and not having to tap into primary care and or local authority services. So I think, yeah, point well made, Rob.
Great. I can't see any final questions. So thank you, Mark, for that really comprehensive overview, and also really encouraging look forward post-COVID as well. And as we continue, I think, with the theme of looking forward post-pandemic, I'll hand over to Chris, who will introduce the last section on how we prepare for recovery after the pandemic.
Thanks, Chair. So I think there's a set of slides that are just going to go up. It's quite nice to get the mask off, actually, and be able to talk. So following neatly on from Mark's talk about place and the importance of place, the Your Merton programme was originally going to be called Merton the Place, actually, but quite sensibly it's been renamed to be Your Merton, because it's much more than just place, much more than just geography. It's really about ambition for individuals, for communities, and seeks to reflect the changing environment that we've gone through in the borough post-pandemic, and seeking to capture people's aspirations and ambition. I could go to the third slide, please, Amy. So that just gives you a brief summary. I'm hoping that most people listening to this will know about Your Merton. If you aren't already familiar with it, this should just give you a quick pen picture about what it's about. It'll also give you an update on where we are in the timeline and what we aim to do with the findings, which I think will be relevant to all partners around this table and all of the other partnership boards across the council, because of the far-reaching implications of the findings that we expect to capture, and they're already being captured. And as it says here, this is the largest engagement exercise in living memory in the borough, and it's a multi-channel engagement exercise aimed at everyone who lives, works, visits, studies in the borough, so relevant to everybody here. And way beyond this partnership board. And as I say, it's delivered through multiple channels, and I'll touch upon those in a moment. And as I said earlier, it will inform a whole range of work, and the timing is excellent, particularly for the council, in that this will feed into the next budget setting round, the next business planning process for the council, which starts soon after the summer break and concludes with the council tax setting next spring. So it will feed very naturally into that, and we expect to start to pick up on the early findings after the summer break. So how are we engaging people? Four main streams of activity. The first one's already been concluded, and we'll shortly be digesting the results of the telephone-based resident survey. That's something we do biannually here in Merton, as colleagues will know. Usually, always face-to-face on the doorstep of around 1,100 adults. But this time it's been done by telephone, but no less successfully. We know that it's been concluded, and we've seen the early cut of the results, and those will be brought in front of council just after the summer break, once they've been digested alongside all of the other information. There's a dedicated website hosted by a company called Commonplace, and there'll be a snapshot of that on a slide coming up. I urge anybody who hasn't already visited it to have a look at it. You can access it through the council's website. Just type in Your Merton, it'll take you to the link, and it's a really great and very intuitive website, which guides you through a series of opportunities to contribute your thoughts, your ambitions for yourself personally, but for your locality. And there are already hundreds of contributions there, which you can look at. Some of them are anonymous, some of them are identifiable. So that's the second of the streams. And that's open until the 7th of July. The third work stream is just about to commence, and that's directing great engagement through a series of local groups hosted through Merton Connected, who are working with Traverse, the company that the council's commissioned to oversee this work. And that's to do some more engagement with those specific groups and for those groups to reach out to their communities in order to capture their views if they haven't already contributed via the Commonplace site. And then this will be revisited through the fourth stream, which is the sense checking through focus groups, to just take back the findings from all of these streams and other activity in order to test out the findings and put some more, I suppose, qualitative depth onto those results. And this doesn't sit in isolation, so other contemporaneous engagement activity will bleed into the whole picture of the Your Merton findings. So we're aware that the school survey of around 5,000 young people through the schools will also feed into this with a further set of rich data from young people. And the next slide just gives you a snapshot of the Commonplace website, where you can provide contributions on your place, life in your local area, and so on. But I'd urge you to have a look at that. The numbers already contributing to that website are very significant. I think we've had over 600 contributions last week. And you can see the richness. On the next slide, you just get a feel for how you can just very intuitively drop a pin into a local area if it's a particular issue which is about your neighbourhood that you wanted to contribute. But there are other sections of the website which allow you to provide contributions which aren't necessarily place-based. They might be about jobs or skills or health and so on. So that will then feed into how we develop the ambition for the borough, not just as a council, but as a partnership board, I would hope. And as I say, I co-chair the Sustainable Communities Board, and this will be a very rich source of information for that board, as it will be for this board, I suspect. And as this slide makes clear, it will add to contemporaneous activity and information we've got elsewhere. So just 2 weeks ago, I was at the JCC meeting, which was looking at the BAME Voice report on issues that arose through the pandemic. That information will sit alongside the Your Merton research that we're talking about here, in order to provide that rich picture and feed into recovery planning, feed into the council's business planning process. Next slide, please. As I mentioned earlier, this is just one of a series of recovery and modernisation programmes. This is one that I'm sponsoring, but there are a range of other recovery and modernisation programmes that the council is running at the moment in order to reflect the changing environment that we're working in and the opportunities that certainly digital technology provides us and has provided us over the last 12 months. Next slide. Just to say a few words about the timeline briefly before I start to conclude, Chair. We are fairly close now to the end of the digital platform being live, and that's the 7th of July. Before then, we've got a Merton Partnership Executive Board event on the 30th of June, just next week, and that will be starting to look at some of the emerging findings that are coming up, but for Traverse to talk to Partnership Board members about how they will use this information and what their own contributions are. And that then feeds into the timeline going forward, with some of the key milestones being a discussion in September with members reviewing the key findings, and then bringing this out to partnership boards and beyond over the autumn, and feeding it into our business planning processes. Last couple of slides. So working with our partners, it's self-evident really that this will be of use to us all. I'd urge colleagues to share the links with your networks in order to ensure that we get as rich and valuable a picture as possible, and think about how you'll consider the findings in due course, consistent with the timeline. And then the last slide, Chair, just as a real prompt for discussion. if we did have time for colleagues just to think about how they might use this information and how they might feed into the ongoing debate that's live at the moment. Thank you.
Thank you, Chris. And I think some of the outputs of this will be hugely valuable in terms of what we were just discussing in terms of sort of priorities, looking at sort of the ICS, but also that East Merton model of care as well. So something that we'd really want to bring back. But if I do just open this out to the board, if there are any questions or comments for Chris, or how we might want to pull this into sort of wider work. Mark?
So I suppose it's just an invite, Chris, is that we kind of link up outside of the meeting, and as Councillor Lanning was saying, that the outputs of this would be really useful in terms of the ICS and particularly Merton Place. So it's just that invitation really to meet up outside.
Great. Were there any final questions or comments about the process? No? Okay. Thank you, Chris, for bringing that to us tonight. And I think we'll definitely want to see sort of the results ongoing to feed into our work as well. So that does bring us to the end of the agenda and a successful hybrid meeting, I think, as well. Thank you everyone for joining in person and virtually, and look forward to hopefully seeing